Have you ever watched someone you love change almost overnight? One month they are sharp. They remember names, appointments, bills, birthdays, where they parked the car. Then suddenly they start repeating the same question. They lose words in the middle of a sentence. They walk into a room and forget why they came there. And the whole family quietly begins to fear the same thing. Is this dementia? But here's the part most families are never told. Sometimes the first thing stealing a person's memory is not Alzheimer's disease. Sometimes it is not age. Sometimes it is not just getting older. Sometimes it is a medication, not an illegal drug, not something strange, not something hidden. I am talking about ordinary pills sitting in kitchen cabinets, bathroom drawers, and nightstands. Pills used for sleep, allergies, bladder problems, anxiety, pain, heartburn, depression, and muscle spasms. Pills people take because they trust them. Pills that may have been prescribed years ago and never reviewed again. And this is where the danger begins. After 60, the brain does not clear medications the same way it did at 35. The liver slows down. The kidneys may filter more slowly. The blood-brain barrier becomes more vulnerable. And a dose that felt harmless years ago can suddenly start acting much stronger inside the brain. That is why a senior can be labeled as confused, forgetful, or declining, when the real problem may be medication fog. Today, I want to walk you through 9 common medications and medication groups that can worsen memory, trigger confusion, or create dementia-like symptoms in older adults. This does not mean you should stop anything on your own. Some of these drugs are important, even life-saving for the right person. But it does mean you should know what to ask your doctor or pharmacist before you blame your brain. And please pay very close attention to number 1, because it is not one pill. It is the dangerous combination that millions of seniors are taking without realizing it. Let's start with number 9. Number 9 is diphenhydramine. Most people know it as Benadryl, but it also hides inside many nighttime products, cold medicines, allergy pills, and PM pain relievers. This is one of the biggest traps in the medicine cabinet because people think, if I can buy it without a prescription, it must be safe. But over-the-counter does not always mean safe for an aging brain. Diphenhydramine belongs to a class called anticholinergic medications. That means it blocks acetylcholine, a chemical your brain uses for memory, attention, and learning. When acetylcholine is blocked, your thinking can slow down. You may feel groggy, you may feel foggy, you may forget simple things. And in older adults, this effect can be much stronger. Here is the real problem. Many seniors do not take Benadryl once. They take it again and again for sleep. They take it at night because they are desperate to rest. Then they wake up the next day tired, dull, and forgetful, and they think the problem is age. But the problem may be the pill. A common warning sign is this: you sleep, but you do not wake up refreshed. You feel heavy in the morning. You misplace things more often. You feel like your brain is moving through syrup. If this sounds familiar, do not panic, and do not stop everything suddenly. But take every sleep aid, allergy medicine, and PM product you use and show it to your pharmacist. Ask one simple question: does this have anticholinergic effects, and is it safe for my memory at my age? That question alone can protect your brain. Number 8 is oxybutynin and other bladder control medications. This one is very important because many seniors are embarrassed to talk about it. Oxybutynin is used for overactive bladder, urgency, and frequent bathroom trips. For someone who is afraid of accidents, this medication can feel like freedom. It can help a person leave the house again. It can help them sleep through the night. So I understand why people use it. But oxybutynin can also have strong anticholinergic effects. That means it can calm the bladder by blocking the same chemical system your brain needs for memory. So the bladder may get quieter, but the brain may get quieter too. Families often describe it like this: Dad was doing okay, then after a while he became slower. He stopped following conversations. He seemed less alert. He was forgetting things that used to be easy. And because bladder problems are common after 60, nobody connects the memory change to the bladder pill. Here is the key point: you should not have to choose between dignity and memory. There may be other options, including different medications or non-drug bladder strategies, depending on your health history. But this needs a real conversation with your doctor. Ask directly: is this bladder medication crossing into my brain? Is there a lower risk option for someone my age? Do not be embarrassed. Protecting your bladder matters. Protecting your brain matters too. Number 7 is amitriptyline. Amitriptyline is an older antidepressant, but today many people are not taking it mainly for depression. They may be taking it for nerve pain, migraines, sleep, or chronic pain. And because it is often given at a small dose, people assume it is no big deal. But small dose does not always mean small effect, especially if you take it every night for years. Amitriptyline is one of the classic medications with strong anticholinergic activity. It can dry the mouth, cause constipation, make people sleepy, and in older adults, it can cloud thinking. Some people become forgetful, some become unsteady. Some feel like their personality has become duller. The dangerous part is how slowly it can happen. It may not feel like a sudden side effect. It may feel like your mind is aging faster than it should. Here is what I want you to remember. If a medication was started years ago for sleep, pain, or migraines, it should not automatically stay forever. Your body changes. Your risks change. Your medication list should change with you. If you take amitriptyline and you are noticing brain fog, falls, constipation, dry mouth, or worsening memory, ask your doctor whether there is a safer alternative for your specific condition. Number 6 is benzodiazepines. These include medications like alprazolam, lorazepam, diazepam, and clonazepam. Many people know them by names like Xanax, Ativan, Valium, and Klonopin. These medications can be useful in specific situations. They can calm panic. They can help with severe anxiety. They can relax the nervous system. But in older adults, they can also cause serious problems. They slow the brain down. That may sound simple, but it is powerful. When the brain is slowed too much, memory formation weakens, reaction time gets worse, balance becomes less steady, the risk of falls increases, and some people become confused, especially at night. Here is what families often miss. A person may not look drugged. They may just look older. They may talk more slowly, move more slowly, forget more often, sleep more during the day, stop taking interest in things they used to enjoy. And because anxiety and poor sleep are common in older adults, these medications can quietly become daily habits. The most important warning is this: never stop a benzodiazepine suddenly if you have been taking it regularly. Stopping too fast can be dangerous. It can cause severe withdrawal, rebound anxiety, insomnia, and in some cases, serious medical complications. The safe move is a supervised plan. Ask your doctor, do I still need this? Is my dose still appropriate? Could this be affecting my memory, balance, or alertness? That is a grown-up medical conversation, not a panic decision. Number 5 is certain muscle relaxers. This group includes medications often used for back pain, neck pain, spasms, or injuries. Some examples include cyclobenzaprine and similar drugs. Many people think of muscle relaxers as simple pain helpers, but some of them can be very sedating, and some can also have anticholinergic-like effects. In an older adult, that can mean confusion, dizziness, sleepiness, poor balance, and brain fog. This is especially risky because muscle relaxers are often added on top of other medications. A senior may already be taking blood pressure medication, a sleep aid, a pain pill, and something for bladder control. Then a muscle relaxer is added after a fall or back injury. Now the brain is carrying a heavier chemical load. This is when families may notice sudden confusion. The person may seem normal in the morning, then disoriented later. They may say strange things. They may become sleepy, unsteady, or forgetful. And everyone fears dementia. But true dementia usually does not appear overnight. Sudden confusion should always raise the question, what changed? Did a new medication start? Did a dose increase? Was a pain pill added? Was a sleep aid added? Was there dehydration or infection? That question can save someone from being mislabeled. Number 4 is opioids and strong pain medications. These include medications such as hydrocodone, oxycodone, morphine, tramadol, and others. Now let me be very clear. Pain is real. Severe pain can destroy sleep, mood, appetite, mobility, and quality of life. Some people genuinely need stronger pain treatment. This is not about shaming anyone who is in pain. But strong pain medications affect the central nervous system. They can cause sedation, confusion, slowed breathing, constipation, dizziness, and memory problems, especially in older adults or when mixed with other sedating medications. One of the most dangerous combinations is a pain medication plus a benzodiazepine or a sleeping pill. That can slow the brain and body too much. It can increase fall risk. It can increase confusion. It can make a person look far more cognitively impaired than they actually are. And here's another point many families miss. Pain medication can cause constipation, and severe constipation itself can worsen confusion in older adults. So the brain fog may come from more than one direction. If someone starts acting confused after a new pain medication, do not ignore it. Ask the prescriber whether the dose is appropriate, whether it interacts with other medications, and whether safer pain strategies can be added. The goal is not to suffer. The goal is to treat pain without stealing clarity. Number 3 is proton pump inhibitors, also called PPIs. These include omeprazole, esomeprazole, pantoprazole, and similar acid-blocking medications. Many people know them by brand names like Prilosec, Nexium, and Protonix. These are used for reflux, heartburn, ulcers, and stomach protection. For the right person, they can be very helpful. But the issue is long-term daily use without review. When stomach acid is lowered for a long time, some people may have trouble absorbing certain nutrients, especially vitamin B12 and magnesium, and both of these matter for the nervous system. Low B12 can look like aging. It can cause memory problems, numbness, tingling, weakness, balance trouble, mood changes, and fatigue. Low magnesium can also affect muscle and nerve function. The research around PPIs and dementia is mixed. Some studies suggest a possible association, while other analyses do not prove a clear cause and effect relationship. So I do not want to exaggerate this. PPIs do not automatically mean dementia, but I do want you to ask a smarter question. If you have been taking a PPI every day for years, has anyone checked whether you still need it? Has anyone checked your B12? Has anyone talked to you about the lowest effective dose, a step-down plan, or lifestyle triggers for reflux? That is the issue, not fear. Review. Because sometimes the problem is not the acid medicine directly. Sometimes it is the nutrient shortage that develops quietly while nobody is looking. Number 2 is paroxetine and other high-risk mood medications for older adults. Paroxetine, often known as Paxil, is used for depression, anxiety, panic symptoms, and other mood conditions. It belongs to the SSRI family, but it is not exactly like every other SSRI. In older adults, paroxetine is often considered more concerning because it has anticholinergic activity compared with many other antidepressants. That means it can affect the same memory chemical system we have been talking about. This is important because depression and anxiety themselves can cause memory problems. A person who is depressed may have poor concentration, low motivation, slow thinking, and forgetfulness. So when a medication also adds brain fog, the picture becomes confusing. The patient may think, my depression is getting worse. The family may think, this is dementia. But part of the problem may be the medication choice. Again, do not stop an antidepressant suddenly. That can cause withdrawal symptoms and mood relapse. But if you are over 60 or 65 and taking paroxetine, it is reasonable to ask your doctor if it is still the best option for you, or whether a lower risk alternative would be appropriate. Mental health matters, but the medicine used to protect the mind should not unnecessarily cloud the mind. Now we come to number 1. Number 1 is not one medication. Number 1 is medication stacking. This is the hidden danger that most people never hear about. One pill may cause a little fog. Another pill may cause a little drowsiness. Another may dry the mouth and slow acetylcholine. Another may affect balance. Another may lower B12 over time. Each medication by itself may look acceptable, but together they can create a brain burden. Imagine this common situation. A person takes Benadryl at night for sleep, oxybutynin for bladder urgency, amitriptyline for nerve pain, a benzodiazepine for anxiety, a pain pill for arthritis, and a PPI every morning for reflux. Now the family says, Mom is declining fast, but is it dementia? Or is her brain carrying 5 different medication effects at once? This is why a medication review is one of the most powerful brain protection steps after 60. Not a quick glance, not, "Are you still taking these?" Okay, I mean a real review with your doctor or pharmacist. Every prescription, every over-the-counter pill, every sleep aid, every allergy medicine, every supplement, every PM product, every old bottle you only use sometimes. And here are the exact questions to ask. Could any of these cause confusion or memory problems? Which ones have anticholinergic effects? Which ones increase fall risk? Which ones are still necessary? Are there safer options for someone my age? Could any of these be interacting with each other? Should we check B12, kidney function, or other labs? That conversation can change everything, because medication-related memory problems can sometimes improve when the cause is found early. Not always, not magically, but sometimes a person becomes clearer, steadier, more alert, and more like themselves again after the medication burden is reduced safely. And that is why I want you to remember this sentence. Before you accept memory loss as permanent, review the medicine cabinet. Do not stop medications on your own. Do not throw away important prescriptions. Do not make fear-based decisions. But do not ignore the possibility that a pill meant to help one part of the body may be hurting the brain. If you are over 60, or if you care for someone over 60, make a list today. Write down every pill, every dose, and why it was started. Then schedule a medication review. And in the comments, tell me this. How many medications do you take every day? Not the names if you do not want to share them, just the number. 1, 3, 7, more than 10, because the number itself can reveal risk. And if this video helped you, share it with someone who keeps saying, "I'm just getting old." Maybe they are, but maybe their brain is asking for a medication review. I'm Robert Hale. Stay sharp, protect your brain, and I'll see you in the next video.